I'm Dr. Amit Malik. I'm the founder and CEO of Amaha. So mental illness in India is a huge problem, right? There are nearly 195 million people suffering from mental illness in this country. When you think about things like depression or depressive illnesses, as we psychiatrists call it, there's 60 million people suffering from depressive illnesses in this country. Nearly 50 million people suffering from anxiety disorders or anxiety as we know it. When we add other conditions like schizophrenia, bipolar disorder, obsessive compulsive disorders, and addictions, all in all put together, it's a huge challenge in terms of healthcare access and healthcare in this country. Right now, when you think about where the problem sits, there's more prevalence in urban India compared to rural India, and for some of these conditions, more women are suffering compared to men. Right now, what is the big challenge with mental illness besides the numbers? There's a lot of stigma still in terms of people wanting to openly talk about their mental health conditions. There's access to high quality support is still a challenge. Sometimes people still struggle with awareness. Now, awareness exists at two levels. One is the conceptual awareness, that I know that something like depression exists, or I know something like anxiety exists. But the second is this idea of self-awareness, that I might be suffering from that. So at both levels, the idea of the conceptual awareness of mental illness, but also self-awareness that I might be struggling, both are a challenge. And then there is a shortage of professionals overall. So when you put all these things together, it's a huge journey. So COVID has been a huge accelerant in multiple ways when it comes to mental illness and mental health in this country. Now, let's talk about what the impact has been on our health directly. So there was a study that was published in Lancet, which is a very reputed medical journal, which talks about nearly a 35% increase in the prevalence of common mental illnesses like depressive disorders and anxiety disorders. So that's a huge increase in the absolute numbers themselves. Beyond that, the number of stresses we experienced, right? Whether it was the social isolation or job stress or anxieties about the health and wellness of our loved ones, all those things have led to a significant increase in overall stresses in the system that then form a risk for mental illness overall. The silver lining, though, is that the awareness of mental health conditions has gone up significantly. So even as a system or a platform, we see significantly more people, almost 6 to 7 times more people post-COVID than we used to see before COVID. And a lot more people are now accessing support because a lot of people are talking about it, right? From the Prime Minister to sports personalities to Bollywood personalities to the common man, it's become more and more acceptable, especially in urban centers. So start talking about your mental health challenges, and I think that's been an impact of COVID to a large extent. So for effective treatment of mental health conditions or mental illnesses, what is required is a coordinated approach, right? We know from science, from experience, from clinical evidence that what works really well is a coordinated approach to treatment. Now, what does that look like? It looks like everything working together for the care and support of the individual to help them feel better, get better, and stay better, right? So let me make it more tangible, right? So there are two large professional groups that work within mental health. There are many, but there are two most significant ones, which is the medical doctors, the psychiatrists, and the psychologists, right? And a lot of conditions require that they work in partnership, not with just with each other, but with the individual and the family to help on the path of recovery, right? Then other things come into play, right? There are things like self-care tools, there's things like self-monitoring, trackers, community support. All of that needs to work together with psychologists and psychiatrists for the recovery of the patient and the support of the family, and most importantly, in partnership with the patient and the family. So that's what's required. I am a trained psychiatrist. I've been one for nearly 20 years. I went to medical school here in India and then moved to the UK, trained in psychiatry there, practiced in the National Health Service, and then also ran and managed large teams of mental health professionals and mental health services in the UK. And there's a lot of learning there of how one could really manage large systems of mental health effectively to be able to provide high quality people that enables a large number of people to get better, feel better, and stay better. And I moved back to India with this singular mission of saying, how do we build a solution for India which incorporates some of the learnings, but also then contextualizes it to the Indian ecosystem? Because the needs are very different here, the social milieu is very different here. So how do you take those learnings and then bring them here to the Indian ecosystem? And so I moved back here, I spent some time learning from some of the best healthcare providers in this country. Amaha is a mental health organization that provides end-to-end care for all mental illnesses across the age spectrum. We have everything from self-care, therapy, psychiatry, community support, delivered both online and offline in our centers now in Delhi, Bombay, Bangalore, so that the individuals and the families we work with can get the full spectrum of care that they need for their recovery in a coordinated manner, so that all the professionals and the ecosystem works together for their recovery. We also acquired and partnered with India's leading child mental health organization called Children First last year, so that now we can provide mental health support for that age group as well, and then can be continuous mental health support across the age span. We work with a large number of organizations, employers and educational institutions to provide mental health support to their employees and students and faculty, so that they can get access to the right kind of help at the right time. And in that journey over the last 6 years, we have now touched more than 45 lakh lives. We have people seeking one-to-one support from our professionals, and we have over 110 mental health professionals full-time working with us. We have people seeking support from our professionals, therapists and psychiatrists from over 300 cities in India, and when they need face-to-face support, they then come to our centers.